My name is Courtney Andrews Deaton. I'm an MSN FNP student at Arkansas State University. I'm going to discuss my findings on the adherence to hepatitis C screening guidelines within a family practice clinic setting. I would first like to thank my mentor, Dr. Christopher Jordan, and my clinical instructor, Dr. Savannah Coyne, for all their guidance and assistance while conducting my study. Hepatitis C virus, or HCV, is a threat to the health and longevity of American citizens from every state, gender, age, ethnicity, and social background, making early screening and treatment a priority. So much so that in 2012, the United States Preventative Service Task Force made a Grade B recommendation to offer a one-time screening for HCV infection to adults born between 1945 and 1965, also known as the baby boomer generation. The Arkansas Department of Health supports this recommendation to screen baby boomers for HCV in an effort to identify and treat the illness and prevent an increase in chronic liver disease in the future. Hepatitis C virus is the most common chronic bloodborne pathogen in the United States and the leading cause of complications from chronic liver disease. Chronic liver disease is the 10th leading cause of adult death in the United States, and studies indicate that 40% of these cases are HCV related. The CDC reports that while anyone may become infected with HCV, 3 out of 4 Americans infected were born between 1945 and 1965. Persons in this birth cohort have been living with HCV infection for more than 20 years and are reaching the age where detection is critical. The purpose of this study is to evaluate the adherence of a local family practice clinic in Arkansas to the USPST guideline recommendations of providing a one-time screening for HCV to patients born between the years 1945 and 1965, compared to the national average of 13.9%. Prior to conducting this study, IRB approval was obtained through Arkansas State University. The study was conducted by using a retrospective chart review. 50 charts were randomly selected and reviewed through electronic medical records in a rural Northeast Arkansas primary care clinic, and a data collection tool was used to evaluate the data. The collected data included patients seen from November 1st, 2018 to November 1st, 2019, and included age, date of birth, and the CPT code 86803, which is the HCV antibody screening test. My study included patients, male and female, aged 54 to 74 years old, and excluded all patients younger than 54 or older than 74. Here are some other interesting facts about the prevalence of HCV in the baby boomer generation. The CDC reports that this generation is 5 times more likely to be infected with hepatitis C, and that 75% of people diagnosed with hepatitis C were born during this generation. My study found that only 2% of patients, that is 1 out of 50, who met the criteria were actually screened for HCV at this clinic. Compared to the national average of 13.9%, this is an 11.9% variance, and there is much room for improvement. HCV is a slowly progressing disease and may be asymptomatic for decades, leading to a delayed diagnosis and treatment, and may increase severity of the disease at the time of diagnosis. There is no current vaccine for HCV, however, it can be cured. Therefore, it is important to screen for this disease in high-risk populations in order to detect and treat this infection and reduce morbidity and mortality related to its effects. The results of this study show that the USPSTF recommendation of a one-time screening for the baby boomer generation is not being followed. It is important to educate providers about the guideline and encourage screening reminders such as medical alerts in the patient's chart who meet criteria. Again, I'd like to acknowledge Dr. Christopher Jordan, my mentor, and Dr. Savannah Coyne, my clinical instructor. Here are some of my references, and the other references are available upon request. Thank you.